So, so Dr. Ting, I'm going to just jump into some basic questions. Tell us, how can a person know if they are a candidate for the MSE? What are the uses and indications for the MSE?
Now, MSE is basically for structure correction. Okay. Now, structure correction means if your upper jaw, the bone structure is actually narrower than the lower jaw, then you are a candidate for the MSE. No matter what tooth direction do you bite, no matter how you're biting on it, because you have a structure issue. Now, the nice side effect of the structure correction is once you expand your jaw structure on the upper jaw, you expand the maxilla, you automatically simultaneously expand your nasal cavity. So your nasal volume will increase. Okay. So you can use MSE to correct various problems, for example, crossbite, okay, or grinding issue, clenching issue, and also airway issue will be improved with the MSE. And also we can use MSE to control the vertical dimension. Some people have excessive long face, those who can control them pretty well. So MSE is it's a tool, not a single purpose tool that provided for the practitioner. So it depends on the practitioner's experience how to explore the tool. It's like if you give you a power drill, you can do so many things with a power drill, but depends on what you know, how you deal with it. Okay, that's basically what the MSE is.
Understood. And these deficiencies that the MSE can be used to help fix. So in what I do through my blog and through my YouTube channel, I constantly have people asking me whether or not they're candidates for the MSE. Oftentimes these people have functional issues that they're trying to address: breathing, grinding, TMD. A lot of times though, patients just want to change the way they look. And so would you say, however, a lot of times these patients, their more traditional orthodontist says, that's crazy, you don't need the MSE, you're not a candidate for something so invasive and excessive. Would you say, though, that what percentage of the general population could benefit from the type of expansion you get with the MSE?
I think general minimally 60% population to benefit from MSE, and as much as 80% I believe in. Okay, there's a lot of gray area that I like to recommend MSE, but at the same time, I don't want to be called performing excessive treatment. So I would say 60% would be a good number, because as we know, if anyone watching this have been done research on this topic, that human jaw development had been stalling since the civilization because of our soft diet. We don't use teeth as a tool anymore. So our jaw failed to grow as much as what we call the early modern human. Okay, so with the narrow jaw compounded with other issues, the TMJ problem that come along with it, the nasal cavity problem come with it, the lack of a wisdom tooth space problem also come with those smaller jaw development. Okay, so technically the majority population can benefit from it. I think for a lay-person point of view, without dental knowledge, the easiest way to compare is if you put your cheek on the side and look at the gum area, the bone area. Don't look at the tooth, because your tooth could be flare out compensating. Okay, look at the supporting bone structure on top and supporting bone structure on the bottom. Once you put your cheek to the side, if you see your upper bone is actually narrower than the bottom bones inside of the bottom jawbone, then you do have a structural problem. Okay, and technical term is you have your upper jawbone supposed to be slightly wider than the lower jawbone. That's a normal skeletal structure supposed to look like. So those are a common self-diagnosed tool you can use if you have good eyes to look at comparing to upper lower jawbone. Again, I specifically mentioned not comparing your teeth, because a lot of patients with narrow upper jaw, they have compensating what we call the buccal flare on the molars. So their upper molar is actually tipping outwards, and the lower molar have lingual compensation. That means they're actually tipping inwards. So you look at the bottom molars are tipping inward, upper molar tipping outward, then most likely you're having some structural problem. Therefore, your teeth are compensating each other.
Right, right.